You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. Our guest today is Linda Wilson. She is of Buffalo, Wyoming. She has been a dental hygienist for more than half her young life. She is a certified nursing assistant. She's also a registered dental hygienist, and we are going to be talking about oral hygiene for elders. Linda, thanks so much for being with us. Tell me what's different? Why oral hygiene for elders? What's the deal?
Well, having been a hygienist for much of my lifetime, I value oral health, that it affects our body completely. It's a very important part of being healthy overall. And just because we're getting older, just because we're getting older doesn't mean that we shouldn't continue to be aware of and take care of our oral health. It can
Is
affect our body. It affects how we eat food, which is important to staying healthy.
Absolutely. Is this something that you have always had an interest, or was there, excuse me, a particular event that sparked your interest in this area?
Well, I feel like it was a bit of a calling because I've been a dental hygienist since I was 19. So I just went right into that and really have embraced it and loved it. And I've always had a concern about, I would hear about people perhaps in a long-term care situation, even my own grandmother where she was not getting the oral care. And I would go visit her and I couldn't, she had dentures, which is still needs care, and I couldn't even find her dentures some of the times. As a dental hygienist, that was important to me and I tried to pay attention to it for her. But, I saw from my own experience that maybe the people providing care weren't as aware of the importance of oral care.
So, how did you start? How did you get involved in this, then spreading the word that oral care for the elderly is different?
Well, it's something I've wanted to do. However, when my family was growing up, I was the breadwinner in my family. So now that I have more flexibility, I decided to try to find a way. Like it's something I've wanted to do, some part of my practice that I've wanted to concentrate on. So I got my CNA and I went to I was trying to figure out a way to fit in to do that, to make that happen, whether it be being an oral care CNA, which I don't think there is such a thing really here in Wyoming, but I went to an infection control seminar in Casper and was telling everyone there that I was a dental hygienist and a CNA, and I wanted to figure out how to put the two together. So Shannon Grisham, who was at Crook County Medical Services District Long-Term Care, invited me to come and speak to her staff. So that I made that blossom into,
Uh-huh.
kind of a clinical also situation. So that was my pilot project too
Mhm.
in training.
So, how are you in the process of getting out the word right now? Do you go make speeches or presentations, or how do you do that?
Well, I just had the opportunity. I received a grant from the Wyoming Nurses Association and had the opportunity to present my program to the attendees in my class. So that was one way. Speaking with the Dementia Together Network, Sabina d invited me. her last name is escaping me right
Sabina
now.
Shank,
Shank.
uh-huh,
Uh,
right.
invited
Sabina
me
Shank.
to do that presentation. So those have been my little legs getting started. But in the meantime, I've been sending letters to nursing facilities specifically to share what I have to offer and hope that someone else will, you know,
Mhm.
jump in there and invite me to come and help them.
I don't know, Linda. It sounds like there's a book in the works down the road. What do you think?
Well, I would definitely need a helper.
Let's take a look at some of the things that you talk about when you make your presentation. Let's start at the beginning. To me, just as the I don't know the dental novice, it seems like it's just brushing your teeth. What's the big deal? Why is it different for the elderly?
Well, oftentimes elderly people can't provide their own care as well. And they may not remember they need to do it. Another problem with elderly and people taking a lot of medications, even myself, as we get older, our mouths get dry. They tend to that allows the food to remain around the teeth and also encourages the bad bacteria to grow. So if you're not brushing or not able to brush, then dental decay can occur more quickly. That can lead to infection, which can affect the whole body. The bad germs that cause dental issues can affect the whole body in other ways. Diabetics can find it more difficult to control their blood sugar and also find it more difficult to keep their mouth healthy through gum disease is more prevalent in people with diabetics. Aspiration pneumonia is a problem. It affects the cardiovascular system.
Mhm.
Many other ways that we're learning that it can affect health.
Yeah, I definitely want to talk about aspiration pneumonia here in a bit, but what do you work in? You talked about going into nursing homes and talking with CNAs. Do you work in the area of helping dementia patients also?
Um, a- if they're in that facility that, and there are, absolutely. I mean, in my practice, I practiced private dental practice, which those are not the people that really need dental hygienists. The
Mhm.
ones that need dental hygienists are the ones that don't go to the dentist. But absolutely, I dealt with them in my private practice, and definitely when we were at Crook County, there was, you know, there, yes. The long answer is yes.
Right. We're talking with Linda Wilson of Buffalo, Wyoming. She is a dental hygienist. We've been talking about oral hygiene for elders. So when you go and you speak to CNAs, you actually go into the nursing home and do some training in these areas. Where do you start? What do you do? What are the important steps?
Well, first, the information, I have a PowerPoint presentation very much like the one that you saw with in it. So we talk about why it's important, why bother. We talk about complications that can arise if oral care is not provided and ways to overcome providing care that might be difficult. I do have some tips for dealing with people living with dementia that maybe if they're not feeling very cooperative at the moment, and ways to brush and clean the in-between sides of the teeth that people may not be familiar with, and what kind of tools to use. And we also talk about some products that might be helpful, that might be a little different than what we're used to
Mhm.
seeing or using on our own, more mainstream products. And then that's a 45-minute presentation.
Right.
So Once we go through all of that and they have the CNAs have that background, then I've spent a couple of days working individually with the CNAs with residents, brushing and cleaning the in-between sides of the teeth.
So your training can last more than one day?
Absolutely, preferably. Even practicing on each other is something that I feel is important, and I recommend during the during the talking, the didactic part of the educational program.
Linda was referring to a moment ago, she was referring to a presentation she made to our Wyoming Dementia Together group, and she was able to present that program back in August of 2025. We're actually taping this at the end of October of 2025. There's a lot to cover, and we are actually in this is part one, and there's a lot more to get to. And we will be covering that in part two. And we invite you to stay tuned for that program that's coming up later. You've been watching once again a YouTube video presentation of the University of Wyoming Center on Aging. We hope if you haven't done so already that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.